Well, good morning, everyone. I'm Robert Merja. It's an honor to be here with Dr. Robert and Dr. Margaret today. I had an amazing time doing my fellowship with them. So over the next several minutes, I'll be discussing complications of non-ablative wavelengths and how to avoid them, as well as sharing a few personal cases I've seen in the first few years of my career. So here's what we'll be covering in the next few minutes. So as we all know, the use of laser and energy-based devices continues to rapidly advance in both the medical and aesthetic field. In most cases, treatments are associated with mild transient adverse events, and fortunately, long-term complications are uncommon when the proper precautions are taken. Although these treatments are generally safe and well tolerated, the complexity of the procedures and the potential for adverse events shouldn't be underestimated. So a multitude of factors can lead to errors while operating lasers: inadequate training, insufficient documentation, limited pertinent medical history, failure to perform test treatments, and incorrect diagnosis or treatment indication can all potentially lead to complications. A thorough consultation is necessary prior to any procedure to provide detailed information regarding the planned treatment, the potential risks and benefits, and alternatives, the costs, and to promote realistic expectations with the patient. A discussion regarding post-op care, including photoprotection and additional follow-up, are vital to minimize poor outcomes. Many other factors can also affect the outcome of laser treatment and should be evaluated prior to therapy. These include the indication for the treatment, the location, the Fitzpatrick skin type, if the patient has a tan or spends a lot of time outdoors. Patients with darker skin types often require more conservative treatment with lower fluences, longer wavelengths, and the proper tissue cooling. So anyone operating a laser should be aware of the risk of misdiagnosis of cancerous lesions and the importance of a dermatologic evaluation prior to treatment. Dr. Avram's group reported a series of 3 patients, with one referral actually coming from a dermatologist within just 2 months of one another, presenting for cosmetic removal of pigmented lesions, only for them all to be found to be melanoma. So this report highlights the need for careful evaluation of pigmented lesions prior to laser treatment, regardless of the referral source they're coming from. So while putting this presentation together, this patient presented to my practice after receiving laser treatment at a local med spa for over 2 years to remove this pigmented lesion on her cheek. And after careful examination, it came back as a melanoma. So once there's no question regarding diagnosis, most complications can be avoided or minimized by paying careful attention to the tissue reaction upon initiating treatment. It's vital to be able to recognize an immediate adverse response, such as tissue whitening or graying, which indicates thermal injury and requires prompt discontinuation of treatment. So the therapeutic endpoint for vascular lesions depends on the type of the lesion. Immediate vessel disappearance, or as you can see here on the left, or vessel darkening is the proper therapeutic endpoint for telangiectasias treated with vascular-specific devices. However, immediate purpura is the desired endpoint for port wine birthmarks treated with vascular lasers, as you can see here on the right. When performing laser hair removal, the desired endpoint is perifollicular erythema and edema, which can typically develop after a few minutes. When we're treating patients with darker skin types, erythema can be a little more difficult to appreciate. Regarding pigmented lesions, the therapeutic endpoint depends on the pulse duration. When using a more selective Q-switch type device, we will see immediate whitening confined to the pigmented lesion. As you can see here, since 532 and 1064 nanometer wavelengths also target hemoglobin, you may see some purpura and petechiae as well. When we're using longer, more gentle pulses like millisecond pulses, a subtle darkening of the target lesion without change in the normal skin is what you should be looking for. When treating tattoos, the therapeutic response is quite similar to that of a Q-switch laser treatment of pigmented lesions. Tattoo should never be treated with a long pulse device due to the risk of scarring. Treatment with non-ablative fractional lasers typically leads to edema and mild erythema, which can be appreciated within a few minutes following treatment, corresponding to the left side of this patient's face here, as you can see. Treatment may or may not cause some small white dots corresponding to the microthermal zones. So depending on the type of laser and the procedure, temporary and transient side effects are quite common, and for some treatments, they may be the desired endpoint. Erythema is often accompanied by edema and is almost always present due to heat following any procedure, but tends to improve within about 24 hours. Purpura is very common and expected when using a pulse-dye laser, especially using pulse widths below 6 milliseconds, and this usually fades within about 7 to 10 days. Pain may be experienced with laser hair removal and may be minimized with the use of longer pulse durations and improved cooling methods. Complications and adverse events arising from laser treatments can be thought of as an undesirable or unforeseen outcome after a particular treatment. However, some of these side effects, if they become severe enough, can turn into complications. So when treating vascular lesions, complications such as bruising, hyper and hypopigmentation, as well as scarring may occur. Although purpura is common and expected with the use of pulse-dye lasers, it generally fades after 7 to 10 days. This patient of mine of Filipino background experienced bruising more than a month, even though we used conservative fluence and a 3 millisecond pulse width, and this resulted in several phone calls and messages to the office until things resolved. Dyspigmentation can follow treatment of vascular lesions due to the coabsorption of melanin, seen here after pulse-dye treatment for the legs. And finally, short pulse durations and excessive fluences using pulse-dye lasers may rarely lead to scarring, as you can see here. Complications of pigmented lesions and laser hair removal are often due to improper patient or device selection, but they can, And so this patient here, she presented after she developed blistering and subsequent hyperpigmentation after improper use of a hair removal test spot, which they used a 755 nanometer wavelength. As we know, a 1064 nanometer wavelength is the preferred method when treating darker skin types due to its longer wavelength and its deeper penetration, thus reduced melanin absorption. Additionally, you would never want to perform a test spot on someone's face, and you'd want to pick a more inconspicuous area on the body. Hypopigmentation may also be caused similarly. This patient presented after purchasing and using an at-home IPL device on Amazon. Arcuate-shaped burns, which can lead to scarring, can result from the angling of the handpiece during treatment of curved surfaces, leading to misalignment of the cryogen spray relative to the laser spots. The handpiece must always be perpendicular to the skin, especially when treating areas such as the face and the legs. This patient experienced scarring of his tattoo following laser hair removal. Long pulse lasers should never be used over tattoo pigment because they greatly exceed the thermal relaxation time of the ink particles and the cells containing the ink, which leads to heat diffusion into the dermis, causing scarring to normal skin. So paradoxical darkening of red or pink tattoos after a Q-switch laser usually occurs due to the reduction of ferric oxide to ferrous oxide. And this tattoo ink darkening is considered to be irreversible. However, with continued Q-switch treatments, we can help with removal. This complication is most commonly seen during treatment of cosmetic tattoos used as permanent makeup on the lips and the brows. Acne and milia can be a more commonly seen complication associated with non-ablative fractional treatments due to the disruption of the pilosebaceous units caused by inflammation of the and follicular occlusion following treatment, as well as due to the use of occlusive ointments for aftercare. Patients with a history of acne are usually more prone, and treatment with topical or systemic antibiotics can be helpful. This patient was prescribed doxycycline, then developed a full body rash, resulting in further complication. So although fractional non-ablative devices are considered very safe, poor technique can lead to unfortunate scarring. Pulse stacking or too many passes, high fluences, and inadequate cooling can all lead to thermal injury, and certain locations, such as the jawline, may be more likely to scar. So to conclude, a knowledge of laser mechanics is vital when operating these types of devices. We need to carefully select both our patients and settings appropriately and do our best to manage expectations. And finally, it is of utmost importance to identify the cause of our complications in order to prevent them in the future. Thank you.